Hello, everyone. Thank you so much for having Megan and myself in your room tonight, wherever you are watching on the many platforms that I've got this broadcasting out on live. And also, if you're watching this on replay, thank you so much for being curious enough to tune in and listen to what we have to say. Welcome, Megan. Thanks for joining us.
Thank you so much, Tracy. It is such a pleasure to be here to help to kick off National Diabetes Week.
Absolutely. It is National Diabetes Week starting today, and it just sort of occurred to me that I've got access to so much great information, and what a great opportunity to bring this information to people. So I hope everyone really enjoys what I do bring this week. And please, if you've got questions, ask away, let us know where you're from, share your stories. If you want us to see your name, because I'm using StreamYard, if you don't grant them access, so it'll come up saying Facebook user, but if you want to actually see your name, just type it in the comments so we can see who is watching, where you're from, and what you'd like to know. Before Megan quickly introduces herself, I just want to let you know what we are going to go through tonight. So if you've got questions, you'll know what's going to be covered. So obviously we're going to talk about what type 2 diabetes is, what are the risks of poorly managed type 2 diabetes, what are the physical signs, because type 2 diabetes can be, the signs do show up often a long time before the diagnosis comes. What can you look for in blood tests? What can be done to prevent or reverse the condition? And then we're going to talk about what are the barriers that I see in my job and what Megan sees in her work as well around really helping people make the changes to their lifestyle that they need to make to get where they want to be. So Megan, did you want to just quickly introduce yourself to everyone?
Yeah, sure. So I'm a clinical nutritionist. I have my own practice in Australia, but I see clients internationally around the world, predominantly helping people with a fat and connective tissue disorder called lipedema, but who often have comorbidities such as prediabetes and type 2 diabetes and a whole other range of comorbidities. So, so I've been, I practice, as I said, seeing people online, and myself have a history of rising blood sugars, and didn't quite get into the pre-diabetic and type 2 diabetic ranges, although depending on who you're listening to and what levels of what your blood sugar levels are, that's a contentious issue, but it's something that I sort of had experienced of starting of blood sugars starting to rise, and that whole insulin resistance type picture is definitely something that I was experiencing. And type 2 diabetes is really common in my family, and I have so many people in my family with type 2 diabetes. My mum was pre-diabetic, and that was kind of one of the instigators for starting what I follow, a ketogenic diet, to keep my insulin levels down really low, which is a great approach for lipedema. But it is also something that that helped my mum to reverse her pre-diabetes, and which is just such a great thing, because that whole type 2 diabetes or insulin resistance is really behind, and we'll talk about more what that is in a minute, behind so many health conditions. So it's something that I really embrace myself, to try to keep my blood sugars down and hopefully avoid that progression into type 2 diabetes.
Yeah, absolutely. Well, you may as well start then with letting everyone know. So what is type 2 diabetes? Because there is often a little bit of confusion around there. Like, diabetes is lumped together. People don't often know the difference between type 1 and type 2. We do have a session coming up in a few nights where we're going to focus solely on type 1, but maybe just a little bit around what is it, and then we can go into all that, understanding what to look for.
Yes. Well, the difference to start with between type 1 and type 2 diabetes, type 1 diabetes is an autoimmune condition that results in people not producing their own insulin. So whereas type 2 diabetes is a lifestyle-induced diabetes that results in really high, persistently high levels of circulating insulin, or particularly in the earlier days. In more advanced, cases, it can people can stop producing insulin. But just to start with, it's that high persistent insulin that's around. The interesting thing with type 2 diabetes is that people will talk about type 2 diabetes as being a condition of high blood sugars. That is true, but that's actually a symptom of type 2 diabetes. But the cause of type 2 diabetes is what we really need to look at here, and that is insulin resistance. And it's interesting because, when you look at how medically how type 2 diabetes is treated, of course, medications target the high blood sugars. They don't necessarily target the insulin resistance. And so when we talk about insulin resistance, that's really about the body. Insulin is a fat storage hormone, or it's a hormone that's produced to move the food that we have into our cells, so for moving the energy into our cells. And so when we're constantly spiking carbohydrates, the more and more insulin that has to be produced to take that glucose, it's called, when it's in your bloodstream, the sugar, out of your bloodstream and into your cells. So we only have about 4 or 5 grams of sugar in our bloodstream at any one time. And when we're spiking that with foods high in sugar, and we're doing that really consistently throughout the day, we're snacking on foods containing sugar, we're having main meals of foods containing them. And when I say sugar too, I don't just mean the sweet stuff. I have a lot of people that say to me, but I don't eat a lot of sugar. But it's the breads, it's the pastas and the potatoes and all of those starchy type foods as well. There's a lot of carbohydrates in a lot of foods, and we've been taught to base our meal around them pretty much. And all of our snacking during the day does that as well. So we're constantly spiking these insulin levels, and we need to produce more and more to get the same effect. And then over time, insulin, sometimes it's 5 or 10 or 15 years of overproducing this insulin. The cells are no longer receptive, and that's when blood sugars start to rise. And so what we find is that a lot of people are going to the doctors, having their health checks, having their blood sugars tested, and the blood sugars are fine. They're within the normal range. So people are being told that they're fine and they're doing really well. But what we know is that actually they're not looking in the background to see this insulin resistance problem or issue going on. And so that's where the real shame is, because we're waiting until the end result starts happening, where we start seeing the symptom of blood sugars rising, and we're skipping the whole, pathological process that's going on in the background with insulin. It's interesting, though, when we talk about the cause of insulin resistance, we're really having the conversations around high carbohydrates, that it's high carbohydrates that's causing insulin resistance. And there are a lot of people that are talking about, actually, it's not necessarily the carbohydrates that are causing the insulin resistance, but that, again, is a symptom of insulin resistance. So once you are insulin resistant, your body doesn't cope with carbohydrates very well. And it's a little bit like people who are lactose intolerant, for example. You would not prescribe a diet full of dairy for someone who is lactose intolerant. Once you become carbohydrate intolerant, which is that insulin resistance, your body is no longer able to cope very well with processing carbohydrate foods. You then, therefore don't go and prescribe a diet that's high in carbohydrate foods. But I think more importantly, we have to look beneath that and to the cause of what's happening. And really what people are saying is that is coming down to vegetable oils and the types of foods we're eating, which have an imbalance in the type of oils that they contain. And what I mean by that is typically foods like pork and chicken that become really high in what's called a linoleic acid, which is a polyunsaturated acid. They actually change how the body functions and the metabolic, the way our cells actually function, which is interesting because, they look at tribe groups, for example, different traditional tribes who had really high carbohydrate consumption, like 90 to 95% of their diets were carbohydrates, yet they don't become insulin resistant. And so when they take a look at all of these traditional tribes, what seems to be lacking, or the factor that seems to be different with Western diets, is the vegetable oils. And that's because they don't signal the cell in the right way that the cell has enough nutrients, and so it keeps the cell insulin sensitive, which means the fat cell insulin sensitive, which means it keeps requiring more and more nutrients, and so that's an issue because these fat cells start getting bigger, and this is where insulin. Sorry, I should go back a step. That once these fat cells start getting bigger, they start leaking fat from them. And once that happens, that starts signaling the rest of the body to become insulin resistant. So it's a little bit more detailed, and the biochemistry is really complex. So I'm trying to really simplify it.
Nice.
But it's really interesting, and it essentially means that the fat cells become overly sensitive, yet systemically you have this insulin resistance. So, when we look at that, it's coming more so from the dietary fats that we're consuming.
That's fascinating. And you did explain that in really, understandable terms. So it's almost like the perfect storm, because we look at the diet that people are consuming and we're told to consume. I mean, a lot of people watching may realize that, processed foods contain that combination of seed oils and carbohydrates. So it's almost like, this perfect storm that we're creating. But the reality is, for most people, when, we become insulin resistant, it's not that we lose that kind of luxury then to, to be allowed to sort of eat a whole lot of carbs and get away with it. It's interesting. I just think that's fascinating, because I think I came into the area because I was insulin resistant myself, and I certainly went down the carbs area. But of course, when we take out carbohydrates and we reduce, for me, it was about health. So taking out the packaged food. So I actually took all that out without really knowing that was causing an issue as well. But I do see a lot of people just focusing in on the carbs and not really also looking at the vegetable oils and the seed oils and the types of fats that we have in our diet. But what you said is that's kind of like, that's the I don't know, like the carbohydrates is the fuel on the fire. The cells are being damaged by the seed oils, and then we're throwing all this other stuff on top of it. And wow, our body's just going crazy.
Yeah, absolutely. And this is also the problem that people find, that once, if you start eating carbohydrates again, particularly in that, if you haven't resolved in the fat cells, because they store these vegetable oils. So if you haven't resolved that and start eating carbohydrates again, you're going to start getting that fat cell expansion all over again. And this is why, we like to focus on the term, which is LCHF, the low carb healthy fats. And I remember when Karen Zinn actually talked about from university in New Zealand. So she's a dietitian and a PhD. That was, in the early days of the low carb movement, and she changed the name, or wanted to change the name, from low carb high fat to low carb healthy fats, because it really is about emphasizing the healthy fats, and the amount of fats that you need is going to be totally dependent on what you're trying to achieve, what your metabolic health is like. For example, someone taking on a really strict ketogenic diet, which is super low carb, is going to need really high fats if they're doing it for epilepsy, for example, and they're of normal weight. They can't afford to lose weight. That's not what they're trying to achieve, and they need the fats to be really high, and for various reasons as well. As opposed to someone obviously who's got a lot of weight on, you're not going to want to include a lot of high fats to be losing weight, because you want your body to utilize its own body fat, and the amounts will change for everyone. But the focus then comes back to being about healthy fats and incorporating. And so it turns out that it's the saturated fats that actually help the fat cells to become insulin resistant. And we're used to talking about we don't want insulin resistance, but there are parts where we want it and parts where we don't. And we want the fat cells to be insulin resistant so they stop growing. We don't want the fat cells continually growing. And that's where we talk about lipedema, which is where fat cells for women in the lower half of their bodies are really growing. That they're highly insulin sensitive, that the fat cells are. So we don't want that happening in any case. And so it's important, really to these saturated fats, which come from the animal sourced foods, providing they're from, grass-fed, not grain-fed or soy-fed, and that type of thing. If you get really good quality meats, can actually help to provide that insulin resistance in the fat cell, and which allows the insulin sensitivity systemically.
So we're looking at the stuff that we've been told to avoid for so long. So it's tallow and ghee and butter and all those good things that we get naturally instead of chemically made.
Yeah. Yes, absolutely. Yeah. And which is interesting because, we've been told for so long that it's the vegetable oils that are better for you, and we've been told to avoid all of those other fats. And, how scary is it when you look at it that actually that very advice that we've been given has created such metabolic dysfunction and is driving, so many other diseases, because when you develop that carbohydrate and glucose intolerance, the things that start developing, of what we call insulin resistance syndrome, which is these clusters of abnormalities that happen, which is things like dyslipidemia, which means that your cholesterol profiles, which is really your lipid profiles, we call them, start becoming skewed. And so our triglycerides really start increasing, and our HDL cholesterol goes down. And that's, a good way of determining insulin resistance is that you can do a triglyceride to HDL ratio, and that expression will indicate insulin resistance, because once your fat cells, start leaking fats, and your liver starts overproducing the creation of fat from glucose. So if you've got too high glucose levels in your body, you actually, you start producing, exchanging that into fat. It's going to skew those profiles. So you start getting those really high triglycerides. And that's a common thing that's also seen in metabolic syndrome, that expanding waist size, the blood sugars going up, the blood pressure going up, the HDL coming down, and the triglycerides being really high. But also things like atherosclerosis, plaque in the arteries, that endothelial function becomes compromised, and leads on to those sorts of things. Elevated clotting factors happen as well. Elevated inflammatory markers, abnormal uric acid metabolism. There's a whole lot of things that start happening. Again, that perfect type storm, when all of that's coming together, that you're going to see these types of things developing. So it's, and of course, that leads into other disorders that you're going to get, like polycystic ovarian syndrome, hypertension, high blood pressure, obviously, and all of these other sort of disorders that are known to come about once you've entered that insulin resistance type picture. Even things like sleep apnea. Plenty of people who are insulin resistant are on CPAP machines because they now have troubles with their sleeping patterns. All kinds of issues that starts coming up, and they're really instigated by this insulin resistance. It's such a big problem, and fundamentally the basis, they're really saying, of just so many disease states that's out.
Yeah, that's what Ben Bickman says. It's insulin resistance is the either directly or indirectly the cause of pretty much most of the modern diseases that we're facing in the world today. So it is something that I think we all need to really understand. And, you've just given us some fantastic information there. So, what apart from what you've talked about, what are the risks of poorly managed type 2 diabetes? Because I think we see a lot of stuff out there, but maybe people don't realize it's an issue of type 2 diabetes.
Yes, well, once you have that insulin resistance picture in your blood, and your blood sugars start rising, that's the initiation of what's developing into type 2 diabetes. So you'll go through a stage of pre-diabetes, and then into full-blown type 2 diabetes. And so the pre-diabetes is really when your blood sugars reach between 5.7 to 6.5, and then type 2 diabetes is from 6.5 onwards with your HbA1c readings. And so once you're getting to those levels, we're told that type 2 diabetes is a chronic progressive disease that you just need to be medicated for, and eventually you'll need to take insulin for, and all of these complications come up, which are things like kidney disease. Chronic kidney disease is so common for people with type 2 diabetes, but also diabetic retinopathy, where you have that hypertension to the blood vessels to your eyes, hypertension, systemic hypertension, and the peripheral neuropathy, where you start to develop numbness and things like that in your hands and your feet, and we know that diabetic complications like diabetic ulcers, where you get these wounds that won't heal, and that type of thing then leads into amputations, and so really severe complications that come from this. And even though if medications are helping you to monitor your blood sugar levels, they don't protect you from those complications. So it's super important, I think, to know what's going on, and to know that there are other ways that if your blood sugars alone are okay, that you need to actually have a look at some other factors to see, if you're at risk of, if this is already at play, and if it is, what you can do to help that. And there are things that you can do to help that and reverse it. We know that type 2 diabetes is reversible, and it can depend, of course, on how progressed you are, how metabolically dysfunctional you are. But we know from long-term studies now that a large percentage of people are able to reverse their diabetes, and certainly people are able to make improvements. And I don't think there's ever a time where you wouldn't be able to make some health improvements from changing your diet. But also looking at, there's a whole range of things that can influence insulin resistance. And that's going to be things like medications, for example. So there are medications that can make that worse. This is really one of those things, is it's not just one thing that's doing it, that you really have to have a look at your lifestyle holistically, to say, okay, well, if you're not moving and not exercising, because we know that helps with insulin sensitivity. And if you're highly stressed, because stress, the activation of the sympathetic nervous system, which is our stress response system, really activate, or certainly it brings about insulin resistance and increases blood sugars, and for varying reasons. But also things like that visceral adiposity, with central obesity, so carrying a lot of weight around your waist. But if you've got that visceral obesity, it means you're actually depositing fat in and around your organs. So you may not even be overweight to be depositing fat around your organs, what we call toffee, thin on the outside, fat on the inside. And that can be quite common with type 2 diabetes. Type 2 diabetics. Poor sleep can also disrupt your insulin sensitivity. So if you're not sleeping well, you're really stressed, you're not managing your own stress levels, you don't have any stress management techniques. Also things like social isolation, things like that increase stress levels. So it can be physical or emotional stress. Medications, things like antihypertensive, beta blockers and diuretics can also lead to insulin resistance. The oral contraceptive pill, and also corticosteroids for people that are taking steroid medications for inflammatory diseases and things like that, find that dysregulates blood sugar levels. Hormone medications like tamoxifen for women who have had breast cancer increases the risk of type 2 diabetes. And also things like low estrogen and menopause, because estrogen and insulin sensitivity are very tied. So for women who will find that they're going through menopause, their estrogen levels have dropped significantly, they're maybe not moving as much, and they're starting to put on a lot of weight, particularly around their waist, and they fall into that metabolic syndrome. That's another really classic time for that to be happening. So a whole range of things that can influence insulin resistance, but certainly eating a lot of foods that are high in carbohydrates, as we said, regardless of what's actually caused the insulin resistance, these high levels of sugars in your blood are leading to that rapid weight gain and causing that ultimate high blood sugar level.
Wow, it's actually, it is really, really complicated. I guess, just kind of help people who are watching who, what can they do? What could they go to their doctor with? What would be some good tests to sort of go? I mean, you talked about a lot of the physical symptoms. I'd love you to add if there's any other. So obviously we're looking at, weight gain around the middle, high blood pressure, all these kind of signs that we need, our body is probably under a bit of stress and we need to look and see what's going on. So what else in that area? And then what are some really, you've mentioned triglycerides, HbA1c. Can you explain HbA1c? And then any other tests that we should know? Insulin?
Yes, insulin. So I think as far as signs and symptoms of carbohydrate intolerance, which is really insulin resistance, you're not processing carbohydrates anymore, feeling, that you can't go for very long periods without food, so you have to eat every couple of hours. And people can often really identify with saying, yes, if I don't, if I go for a couple of hours without food, I have to eat, and that's what we almost call being hangry. Because you just, you just have to eat food, and nothing gets in your way by that stage because your blood sugars are all over the place and you have to rebalance them. Even for some people, sometimes slurred speech can be a symptom with it, getting shaky if you go for without food for very long. A whole range of symptoms, getting really sleepy, particularly in the afternoons, having that afternoon slump, and those sorts of symptoms can be really indicative of insulin resistance. You can also get things like physically that you can see, things like skin tags, little dark like skin tags on your skin, dark patches of skin, particularly around your neck and your underarms. Can indicate that insulin resistance. There's quite a few different symptoms, but certainly that rapid weight gain, particularly around the waist. And so as far as going to your doctor is concerned, this is going to really depend on what doctor you go to and how open they are to doing different tests than what they're used to doing. And it will also depend too on what your family history is, because normally, remember, with medical tests, often based on what the medical history is, what sort of symptoms that you're experiencing, and that type of thing. So but you can certainly, the cholesterol is a really easy one to do. Your lipid studies is easy to do because that's usually being tested anyway. So then looking at the triglycerides to HDL ratio can be a really simple thing to do. You can also get what's called a HOMA-IR, which is for insulin resistance. So that looks at your fasting glucose level and your fasting insulin level, and that does then we do a ratio of that as well. But even just looking at your insulin level, at fasting insulin. So that's not always an easy test to get done. Traditionally, it's been used to look for tumours that start producing too much insulin, but that's not what we're looking for in this case. We're just looking for high insulin levels. You can also have what's called an oral glucose tolerance test with an insulin curve. The oral glucose tolerance test by itself really doesn't tell us very much. But to get an insulin curve with it so that we can see how much insulin is happening or how much insulin you're producing can be done. Although even then you may show, because they only test it over a couple of hours, sometimes that doesn't show anything, because we know that sometimes it takes 3 or 4 hours for people to have a second phase response with insulin. So really what you would be wanting to look at is all of these factors, ideally. You can also have an HbA1c test, and this is something that as you get older, doctors will be happy to do and should be doing really every year. Certainly once you're past 40, I think is when they're supposed to be testing it every year. But what an HbA1c is, a glycated hemoglobin tests. So glucose attaches very readily to hemoglobin, and the blood cells typically last about 90 days. And so this HbA1c tests your glucose and tests the cells of how much glucose is attached to them over the last 90 days. So sometimes that can be a little skewed, that the reading can be lower than usual for people who have conditions, for example, that have lower red blood cell counts, or for women who are having really heavy periods and losing a lot of blood each month, or have some other condition where they have some sort of microscopic blood loss. But essentially an HbA1c is a good test to have, but isolated on its own is, no blood test on its own really is ideal, because you need to know if it's going up or down or which way it's going. So you need to compare it to another test to see that. But also, if an HbA1c comes back at 5.5, for example, you'll be told that your blood sugars are fine. But in fact, we know that if they're already getting up into the 5, they should really be down in the 4s. Maybe around 5 to 5.2.
Yeah, that's one thing Prof notes. I've done, I do my courses through the Nutrition Network, and I did the diabetes one. And he said, a lot of people will disagree with me, but I would say 5.5 is if you don't change things when you get to 5.5, he said 10, 15, 20 years, it'll be type 2 diabetes. So it's almost like that's the wake-up call.
Absolutely, yes, yeah, and he would like to see, Professor Tim Noakes would like to see type 2 diabetes diagnosed really at 5.5, because you're really on that. Once you're on that pathway, you're on that pathway, and there's no point saying, okay, but let's just wait until we're near the end of the pathway. There's no sense in that. You want to catch it at the beginning, and once your blood sugars have started moving consistently, you are in that disease pattern, you're in that metabolic dysfunction pattern, and it's time to do something about it. Then you don't want to get to the point where you're starting to get symptoms or complications, where you're starting to get high blood pressures, which you could already be getting at those lower amounts. So yeah, it's really something that you want to get on top of, and fortunately it's really quite easy to do that. Well, when I say easy, that's a that's a relative term, I guess, because it can be challenging, sure. But as far as the actual fix it way to fix it is relatively simple, and that is taking away those foods that we know are contributing. So even with the vegetable oil issue, some people will still be having vegetable oils but reducing their carbohydrates. As long as you're reducing your insulin, that you're going to improve that picture. So but if you're wanting to create really that better metabolic functioning, you're also best to include having a clean diet and having healthy fats instead of having these vegetable oils and things like that we know are trans fats and things that we know are damaging to the cells.
Well, it's a nice time now to talk about barriers, because I think, as you say, it is an easy solution, but we know it isn't easy. And I guess, I'd love from your perspective what you see in your work as some of the barriers that do come up and how to overcome it. I guess from a coach, because of the work I do, my job as a coach is to really help people overcome these barriers. So most of my clients will come to me knowing about low carb, and they've done the research because the evidence is there. I mean, no one's going to debate any of that, but there's a lot of there's a lot of ideas about what they can and can't do. And, I hear so often, but I don't want to give up my this, and I don't want to give up that, and it's too hard, or whatever it is that people will tell themselves. And I guess as a coach, the first thing I would say, and I would say to everybody listening, that it isn't your fault. There is a lot of shame and a lot of because it is called a lifestyle disease, I think it's quite, people feel very much that it is their fault, and it isn't your fault. And I think really overcoming that is a really big hurdle to seeing that you can move forward. We've been told the wrong thing. We've been given the wrong advice. And I know that you're trying to do your best, and everyone is trying to do their best. And I think just saying that we can see different things and we can then do different things. Change is uncomfortable, but so what? It doesn't stay uncomfortable forever. And I think with getting support and getting someone like you, Megan, the groups, there's plenty of people out there that can support you to take it one step at a time, to kind of, when we do anything new, it feels like we're stretched on this rubber band. It feels awkward. It feels difficult. It feels challenging. We'll be full of self-doubt. We'll be full of habitual stuff around how things we used to do things. We might have family around us that don't understand. We might have even a doctor or a diabetes educator that doesn't understand, but we can definitely overcome that stuff if we take it one day and one step at a time. So, that was just something I want to add in terms of barriers, because I think a lot of them are self-created internally, with the things that we think. And really, it starts with the knowledge, doesn't it? If you're listening to what Megan's saying and you don't understand, do some research. There's plenty of evidence and research out there to help you overcome and understand carbohydrates, that it isn't just, as you say, the sugars, that breads, pastas, rice, they're glucose to the blood, to the body. It's no different than having a whole lot of table sugar. And I think that's a really big one that people really need to be comfortable in, because then you'll allow things like, but fat causes me and that makes me fat. I can't eat fat. But again, that's just a belief that we can overcome as well when we get a little bit of knowledge and we give ourselves time to do, to make the changes.
Yeah, it's so true, and there are so many barriers to change, and some of those are because we've been told for so long that if you're gaining weight, that you just need to eat less and you need to exercise more. And so for the people that that are doing that and are still gaining weight, or they lose weight for a while, because when you severely calorie restrict, your body will lose weight, but after a while, our bodies fortunately are smarter than us, in that they won't let us impose that type of calorie restriction for too long, because we need those calories for energy, and the body needs a lot of energy just to function, just to use your brain, to pump your heart, to breathe. All of these things take a lot of energy. That's what we're essentially eating for. And so when you deprive that for too long, after a while, the body will actually start upregulating some hormones that are going to upregulate your hunger. And that's the point where people feel like they're failing. So people have this failure mentality because, that doesn't work, and eventually you have the rebound weight gain where you actually end up heavier than when you started before. So that's really problematic for people. But you're right, it's all about education, finding the right connection with someone who can help you. There's lots of people who are, there's so much information out there nowadays. For some people, that's a real plus because they can get the knowledge, apply it, get the results and do really well. For others, that level of information that's out there is completely overwhelming, and that can be a barrier in itself, because where do you even start? You've got all of this information. What's the starting point? And how do you know which information to listen to? So it's really about finding someone who can present the information to you in a way that makes sense, and in a way that's going to incorporate how you need to approach life. So everyone is different on how they can make changes. Some people want to jump straight in. Some people want to go slowly. Some people have emotional eating or binge eating issues, and that has to be addressed, because, the thing is with food, and this is what's got us kind of into the problem in the first place, is it is now so abundant. And it's such an easy way to celebrate anything, or, to really deal with any emotion that comes up. If we're angry or sad or frustrated or bored, procrastinating, it just fits so many of those situations so well, and it's readily available. It's right in the next room. It's socially acceptable. We can do it at any time of the day. It's just a way that people have begun to deal with their emotions. And so that has to be addressed. And, I always talk to people about retraining the body to stop intellectualizing our approach to food and to start listening to our bodies again, meaning that when you feed your body the right amount of protein and fats, you're not going to have these big sugar spikes that puts you on that blood glucose roller coaster, and it keeps you feeling satisfied for longer. So you're not going to be needing snacks in between that spikes your insulin levels, and it balances out your blood sugars. And, you know, even just doing that, eliminating the liquid sugars and changing even just your first meal of the day that doesn't include carbohydrates, that alone is going to help, you know, stop that path to complications with type 2 diabetes.
Yeah, absolutely. Is there any other barriers that you see, or common hurdles that that you see in your practice in getting people sort of on this path?
Look, I think some people think it's too expensive because, you know, buying grass-fed meats and you know, just whole foods is sure, it is more expensive to eat a steak than it is to eat a toasted sandwich. But there's a couple of things with that. Firstly, you're not going to be eating as much. You start to self-regulate your appetite a little more, and you're not going to be eating, you know, all of these snacks and eating into the night and eating until midnight. And, you know, eating quality foods, but also, of course, that is really kind of preventative health, that you're going to be, you know, there's the cost benefit of not having, you know, having health conditions and medications and going down that pathway. So I know cost can be an issue for some people, but there are certainly budget ways that you can do low carbohydrate eating. It doesn't have to all be about organic foods and, you know, expensive cuts of meat. And so that's a barrier to change. Some people, you know, it can be really difficult with the people around you and people in families, you know, feel like it's difficult to do low carb or keto if the rest of the family isn't. But again, it's about really finding someone who can help you explore how to do that, because there are definitely good ways to do it. It's just, you know, coming up with the ideas and feeling like you're supported to be able to initiate those changes. I think, yeah, just for some women have just feel so defeated and have lacked, you know, feel like they've been out of control for so long that it can be hard to feel in control, particularly when people are telling you how important carbohydrates are, you know, the food pushers who feel really uncomfortable when someone takes control of their health and is no longer eating the foods that they themselves can't stop eating. And they don't purposely mean to be harmful, but, you know, I have so many women who are having to make these changes to improve their health, but people are trying to push the carbohydrates onto them, because, yeah, like I said, it either challenges their own way of life, or that they just misinformed that say, no, the brain needs a certain amount of carbohydrates to function, and you know, different myths around carbohydrate foods. So, yeah, there can be so many different issues. But again, it's just really about brainstorming, identifying the issue, coming up with, you know, what, you know, is it a real concern or fear? And if, and then working out a solution. Being solution focused is always, I think, the way to move forward and make change.
Yeah. I think, you know, as I said, there's always going to be hurdles in the way, but we can work out a way how to get around them or over them or under them. And I think, you know, really embrace it as a lifestyle. That's something I would say. You know, a lot of people come to me too, exactly like you said, you know, I can't do another diet. And I'm like, it's okay, we're not doing a diet. You know, this isn't a diet. It is a lifestyle. It's a way of life. And it's not about perfection. It's not about, you know, being perfect and eating perfectly every day. It's about doing the best you can. And some days will be better than others. And, you know, but arming it with the knowledge that, you know, if you do the best you can for the rest of your life, you know, your health, you know, you'll just feel so much better. You'll be able to do so much more, and you'll avoid all those complications that, you know, nobody wants. I mean, everyone takes their health for granted until the minute it's threatened, and it is a horrible feeling to feel threatened with your health and be concerned. But then, you know, what we're saying is that there is a lot you can do to stop that even happening. So
yeah, absolutely. And I think there's two parts to that too. What you touched on is that one is that once you are away from these foods and then have them again, and the symptoms all start coming back, because once you take away those carbohydrates and the bad oils, things like reflux resolves really quickly, and your blood pressure starts coming down, and you know, you actually feel really unwell when you have high blood sugars. It's not a nice, comfortable feeling. You just don't feel well. All of those things start resolving. And it's really hard when you're about to embark on something that all you can see is what you're losing, that you're losing your favorite bread, or, you know, there's always a carb that people are particularly attached to, whether it's bread or chocolate or it's, you know, some kind of pasta. All you see is having to let go of that, and you can't imagine actually being on the other side of where you are now and feeling great, and how much better that feeling good all the time is better than the 5 minutes of feeling good that the high gives you from that carbohydrate. You know, the dopamine release it gives you, which it does, and yes, it feels good, but you need more and more of it to feel good over time, which is why, you know, we start eating so many carbohydrates. So being without those symptoms and then having those foods again, and this is, you know, particularly for people doing keto, I deal with people with chronic disease who deal with pain every day. And, you know, taking those carbohydrates away helps to decrease pain levels and improves mobility and does all types of things. So when you start having those foods again, suddenly the people then say, oh, God, that I just felt shocking. Now I really get why I'm taking those foods away. When I have them again, I just don't want them. It's just not worth the physical price that you pay for eating those types of foods.
Yeah, but I think all of us do go through that, and that can be looked on as it's a learning experience. If you allow it to teach you something instead of thinking that you failed, or again, it's, you know, I knew I couldn't do it, or whatever those, you know, little stories that we love to tell ourselves and believe, if we can let all that go and actually look at it as, okay, you know, of course I'm going to, you know, there's going to be times when I'm do that, but look at how I'm feeling. Let that be a learning experience, and tomorrow's another day. You know, really, you've got every minute really to make another choice. You know, it doesn't have to define you, you know, just because you've had, you know, a bad day or week. You know, you can pull it up, you know, when you want to, and just let all those thoughts go.
Yeah, absolutely. Yeah, because it's so easy to beat yourself up, you know, really based on past experience. But now, you know, with this sort of eating, the beauty of it is that it is just all a learning experience, and it's what can you get out of that and build into how you move forward. And yeah, it's about that being solution focused, isn't it? And looking ahead and just doing what you learned from it differently next time.
Yeah, and I love that it is a learning experience, because it's certainly for me over, you know, nearly 8 years I've been eating this way. I mean, how I eat now is fundamentally very different to when I started. And, you know, that evolution is normal and it's natural. It's not like we'll get to this one point and go, right, this is it. This is how, you know, it's always going to look. It will evolve, it will change. And that, I think, is a really, well, I think that's a fun thing. And we can see that as a really fun thing, just to learn more about our body. And yeah, it does tell us when we can, you know, feed it properly, can tap into that wisdom. We do, you know, everything's in there to tell us when we're hungry, when we're full, all of that stuff. But it's just, for some people, it's just been so quiet, and we're not able to hear it until we sort of get those cells working properly again. And
yeah, it's so true. And I think really, you know, we're so used to aiming for perfection, which is something that really doesn't exist. So, you know, we always talk about it being progress, not perfection. You're not aiming for perfection. And I often say to people, you don't walk into a room, you want to learn a musical instrument, you don't walk into a room, pick up a violin and start playing it beautifully. You know, there's a lot of mistakes you're going to make along the way, and it's that repetition and just to keep moving forward and keep going at it. That's what brings you the success. And, you know, not many people are perfect on their instruments, but they certainly make progress, and that's really what you're looking for, is the progress.
Yeah, absolutely. Well, we've got a couple of questions here. If we've got time just for a couple of questions. Someone's asked, what about intermittent fasting? It's probably a big topic, and I would say probably quite individual, but what's your overriding view on intermittent fasting?
Well, I think intermittent fasting is fabulous. And depending where you are in your journey of how and when you would utilize that. So if you're brand new to low carbohydrate eating and you haven't done it before, you can start intermittent fasting, you know, very very gently, I would say, and others will have different ideas, and it doesn't really matter necessarily how you go about it. But I find the success that I have with my clients is doing things in small, sustainable changes. So, for example, you start with time-restricted eating, which is a form of intermittent fasting, and that time-restricted eating normally means that you, to start with, it just means don't eat after 7 or 8 o'clock at night. For some people, that's a big change. And then you're fasting until you have your first meal the next day, whether that's 7 o'clock in the morning or 10 o'clock in the morning or midday for people who are a bit more experienced with it. But just stopping eating late at night is such a big change that you can make. And that's where I would start with intermittent fasting, is to stop that late night snacking, because that, signals, it changes your hormones. It upregulates your hunger hormones, overnight while you're sleeping. Studies have shown that you can have like a 30% increase in ghrelin, which is the hunger hormone. So you're actually increasing your hunger levels by doing that. So I think that's a really nice, gentle place to start for some people. And then for others who are already doing that, the first meal of the day that we talk about with breakfast, should be the first time, or when you're first hungry. So, not listening to this, breakfast is the most important meal of the day. To me, the most important meal of the day is the one you eat when you're hungry. And so if you're not hungry until 11 o'clock in the morning, don't eat until 11 o'clock in the morning. Listen, and that's what I was meaning earlier about not intellectualizing your hunger. Listen to your body and eat when you're hungry, stop when you're not. And that's a pretty good way to be.
Yeah, don't look at the clock. Like so many of us, I used to be like that. Oh, it's 12 o'clock. Oh, well, time for lunch. Exactly that. Just sort of try and break free from a lot of that and tap into it. I think with my perspective on intermittent fasting, I certainly get clients who have a lot of anxiety around it. And I would say that, it's not necessarily something that everybody needs to do. I like to sort of get my clients really fat adapted first and really, getting the diet sort of side right. And it's funny, most of them will kind of say, oh, I'm not really hungry. And I'm like, so that's okay. So it's intermittent fasting without kind of putting a label around it. I think, most of us kind of get to a comfortable 2 to 3 meals a day, eliminating the snacks. We're not going, doing exactly what you said in the beginning in between meals. I mean, that's just such a great place to get to. But also, it will change too as you adapt and as you get healthier, or things will change too. So, there's no real set rules about it. It's really about doing what does work for you, and seeing that you can play around with it too.
Yes, yeah, absolutely. And I think, some people just think, well, if keto or low carb is good, then doing intermittent fasting as well must be better, and doing it all at once. So yeah, I agree. I think starting slowly is actually better, and you can work towards intermittent fasting and learning more about that as you go.
And the last question from Jennifer, she says, I'm confused about carbs in veggies. That's a question. I think it's, I suppose, for me personally, it's not the carbs in veggies that are the problem. For me with Hashimoto's, it's oxalates and the lectins and other things that, were an issue for me over time. But we're not talking about sort of today. If we're looking at it in terms of a perspective of healing type 2 diabetes, do we need to be concerned about the carbs in real food?
Yeah, well, I think a lot of people, once they're told, that the carbohydrates are in vegetables or are in tomato paste or in all kinds of things, that suddenly they're trying to eliminate carbs from absolutely everything, and that's not the point of it. It is about eliminating the refined foods and the really starchy foods. And for some people, can still have small amounts of starchy vegetables, and they're okay with that, and they're happy with doing that. Whereas for other people, those starchy vegetables will be too much, and you need to keep them super low. I follow a ketogenic diet to help manage my health, and I don't eat starchy vegetables, or if I do, I have very small amounts of them. And because I've been keto for a while, I can metabolically deal with that. So as far as veggies go, though, really, if you're just doing low carb, you can be having the real foods, just you wouldn't be having a lot of white potato, for example. Mashed potato is not going to be great because they're really starchy. So learn what are your starchy vegetables and what are your non-starchy vegetables. That's a good place to start. Generally, it's the below ground veggies that are more starchy, and the above ground veggies have less carbs in it. So it's using getting familiar with the amount of carbohydrates that are in different foods and how many you can be having a day. A low carb diet is generally between sort of 80 and 130 grams of carbs a day. That's quite a lot of carbs when you look at vegetables. It's you don't have to be cutting out every vegetable to cut down on your carbs. There can be other health reasons perhaps for doing that, but it still certainly includes different veggies.
Yeah, I mean, you're just going to be so far ahead of the game by just choosing real food over processed food. So that's, for someone new coming into it, that would be the goal. First of all, trying to eat majority of real food. And I was going to say something about the veggies, but it's complete. Oh, that's what I was going to say. This is where I know it has been very, very helpful for people to get a continuous glucose monitor, which is the sensor that can go on the arm for 2 weeks. And then you can really see the response to certain foods. I know people that have had a huge issue with giving up a certain food, just a real mental block. Like, you said, like for me, it was hot chips. That was just something, and I'll still have them every now and again now, but there is usually something. And I think if you put that on your arm and you have the food, it can be really, really insightful to see what exactly is going on. Do you recommend CGMs for your clients, patients?
Look, I think they're a good thing. I don't use it myself. I definitely like to be able to look, whether it's with a CGM or whether it's just with testing, blood sugar levels to individual foods. Because once you go keto, and you get your protein and your fat sort of levels right, so that you know that you're not having those responses, and you can see what ketone levels you're getting as well, so that that you're not having those spikes if you've got higher ketone levels. So sometimes it can just be with monitoring those, but it's definitely something that you can start tweaking once you've embraced that way of eating. I think to concentrate on that right at the beginning, I think puts a bit too much pressure on people. That, as you say, just getting into doing low carbohydrate or ketogenic diets is the place to start, and then getting into that more, there's what we call the biohacking or the bio-individuality, to see how you respond individually to foods, because we all respond differently. So yeah, I think it's a great way, though, absolutely, regardless of which way you do it, whether you get a blood glucose and ketone monitor or whether you get the continual glucose monitor. Such valuable information to have a look at how your body individually responds to things, including things like stress. You cannot underestimate what a massive impact stress has on our health and on our blood sugar levels. So yeah.
Yeah, I've had just before we finish, a funny story on stress. It is funny because it was me. So I did the CGM experiment last year, and I did 1 week keto, and then I did 1 week where I played around with it and tried to do the standard diet that I used to eat. So my porridge and bananas and low-fat yogurt and honey and juice and like a salad with very lean. I had the stand. I only got through a day and a half because I felt so sick. But when I was in the shops trying to find, I had to buy foods I hadn't actually bought for 7 years. I watched, because I was wearing it. It was in the first week, so it was a couple of days. I had to go and buy some cereal and, all that sort of stuff. And I was getting stressed, and my blood sugar went up. And it was just it was just exactly as you say, that happens. It's really, really important to you know, to understand, you know, some people believe that is the number one barrier to fat adaptation is stress. So yeah.
And also the other thing, if you are type 2 diabetic, or really for anyone, watching cooking shows is not great for your blood sugars either, because you have that cephalic phase where you start releasing insulin just at the getting in readiness to eat food, and sort of watching food and smelling food even can start that process, which is one of the reasons why injected insulin is never as good as what the body can do with its own insulin, because it doesn't have that sort of, you know, pre-eating stage food where it starts getting ready. So yeah, I think not even watching cooking shows is a good idea too if you've got a lot of metabolic dysregulation.
Wow, I hadn't even thought about that, but yeah, fascinating, isn't it? How there's just, as you say, there's so much in it, and you've just gone through such an amazing amount of stuff tonight. I'm so grateful. Thank you so much for your time on a Sunday night to share your knowledge with us. You know, there's been lots of comments, not many other questions, but I'm sure people watching it on replay, if you've got questions for Megan, you're welcome to put them in the comments on wherever you're watching. And, you know, we'll do our best to try and answer them. But please, you know, do seek support. You don't have to do this on your own. It is a pretty big thing to change. You do have to be brave. You've got to dig deep. But there's so many people out there that can support you on the journey. And, you know, we're living proof that it's so worth it, because, I mean, I certainly wouldn't go back to eating any other way now. And my energy as a nearly 48-year-old mum of 5 with all that, you know, I just feel like I'm the Energizer Bunny now, and I'm so grateful that I do feel like that. So it's definitely worth it.
Yeah, absolutely. It really is.
Yeah. All right. Thank you, everyone. Thank you for watching. Thanks for your comments. And I'll see you all on Tuesday night when we're talking type 1 diabetes with Tracy and her daughter, Ashley Kimberly. So we'll see you then. Thanks, everyone.
Thanks, Tracy. Thanks, everyone. Bye.